Okay, so here we are going to discuss syphilis. Now, syphilis was first described in the 1600s, and it was the earliest recorded sexually transmitted infection. Syphilis is caused by the bacterium Treponema pallidum, and it is a slim spirochete, so it has this corkscrew type appearance. It is mobile, it has a rotating motility, and treponema is not very easy to grow in the lab, so it does not grow in bacterial medium. Instead, it's going to grow in cell culture. So when you want to diagnose a syphilis, typically you're going to do nucleic acid tests. Now, Treponema pallidum is extremely susceptible to changes in the environments. So it's going to die quickly if it's dehydrated or heated, and it's very sensitive to detergents and disinfectants. So transmission is restricted to direct contact. Now, syphilis or treponema is going to be an exclusive human pathogen, and infection is acquired by sexual contact. Also, it can be a congenital infection from mother to child. So the bacterium can cross the placenta. It is still a major health problem with about 12 million cases each year. So basically, the spirochetes are going to reach the subepithelial tissues by two means. And one is through a break in the skin, or you're going to pass between epithelial cells of the mucous membranes. There is actually little or no inflammatory stage during the initial infection. It's sort of like a silent infection initially. So you're going to get a primary lesion, and the lesion is going to develop and your arterioles are going to swell. Your endothelial cells will proliferate and they'll reduce blood flow. You can also have, because of this, necrotic ulceration seen at the primary site of infection. Oops. So we'll have our primary lesion. And again, you're going to have your immune system kick in, and the lesion will heal spontaneously. However, at this point, the spirochete has already moved to other locations through the blood and lymph. Now, syphilis is going to go silent. So you're going to have a period of silent, before the secondary stage, and also you're going to have a period of silence before the tertiary stage. Now, your treponema is also going to bind to complement and antibodies and coat themselves with these, and this is a way that the bacterium camouflages itself. It does not produce any virulence factors as the disease progresses, but it's so good at being sort of this silent infection that is able to disseminate. So basically for syphilis, we have our primary infection or a primary disease, followed by a secondary and then it's going to go to a period of latency. And during latency, you can have a tertiary infection, and also you can have a lifetime of latency. So you can go back and forth between tertiary and latency. Now again, the primary is going to be the syphilic lesion, and that's going to start as a papule and become an ulcer. And then it's going to heal. The ulcer is a painless ulcer. So let's say our primary. And then you're going to have the ulcer appear about 3 weeks after the infection, and then it'll disappear about 4 to 6 weeks later. You're going to have also swollen lymph nodes, lymphadenopathy, that's going to occur within a week of the lesion. And the swollen lymph nodes, the local draining lymph nodes, can persist for months. The syphilis can lead to unilateral or bilateral lymphadenopathy. Now, secondary is also called disseminated syphilis. And this is going to be a generalized swollen lymph node, so generalized lymphadenopathy. It's going to develop 2 to 8 weeks after that initial lesion. And then you're going to get mucocutaneous macular papular rashes. So this is secondary syphilis. Now this is going to be primarily on the face, trunk, and extremities, including the palms of the hands and the soles of the feet. And you're also going to get fever and malaise associated with this. Now, inside of these lesions, you have a lot of bacteria. And the lesions are usually going to resolve in a few days, but they are extremely infectious. Now remember, syphilis is very sensitive, so it doesn't last long in the environments. It's very easily to be neutralized. However, direct contact will transmit this. Now again, the lesions are going to resolve in a few days. Sometimes it can take many weeks to resolve this, and it probably depends on the immune status of the host. Now latency can last years. And you have no clinical signs or symptoms, but the infection is continuing. The bacterium is still there. It still replicates. And you can have less severe bouts of secondary syphilis, so you can go back to secondary syphilis. Sexual transmission is only possible during relapses, so when you have symptoms. And then transmission from mother to fetus is possible throughout the latent period. So in our tertiary syphilis, we're going to have about 1/3 of untreated will develop a tertiary, and it can be 5 years, 15, 20 years after. And you're going to have the appearance of these gomas, and these are localized granulomatous skin lesions, and they can be in bones, joints, and internal organs as well. Now, the clinical findings are going to depend where this bacteria spreads to. So you can have cardiovascular syphilis. You can have neurosyphilis. And again, it just depends on where the bacterium is. Now, in tertiary syphilis, neurosyphilis is going to be characterized by the meningovasculitis, and you're going to have chronic meningitis, fever, headaches associated with this. You can have cortical degeneration. You have a cloudy cerebral spinal fluid where you have increase in cells, your immune cells, and proteins. You can have also mental changes such as memory loss, hallucination, psychosis. In cardiovascular syphilis, you're going to have the bacteria move into the vasovivorium of the aorta. This is going to cause destruction of elasticity due to necrosis, and you can develop aneurysms as well as aortic valvular incompetency. Now, congenital syphilis is going to be passed from the mother to the fetus, and this occurs after the 4th month of gestation. So if you believe your pregnant woman may have syphilis, you need to get that person treated, and syphilis is very sensitive to antibiotics. So it has to be treated by the 4th month because after the 4th month of gestation, the syphilis will have already disseminated to the fetus. And so this can lead to, of course, miscarriages, but it can also lead to severe deformities and damage to the actual fetus and the baby that gets born. So again, the mother must be treated within that 4th month. To treat, again, this one is very sensitive to penicillin, so it's not a very hardy bacterium, and for that reason, it probably sneaks in and is able to hang out for a long period of time as well because it's so slow and it doesn't cause that much of an alarm system in your actual body.